So we now have Regina Brown, and Regina is presenting to you on nursing in WA Health Country Service, or WACS.
Firstly, I would like to confirm, despite having had a number of questions, WACS definitely do graduate nurse, midwifery and enrolled nurse programs. We recruit in excess of 250 graduate nurses and midwives every year, and we offer a wide range of programs across all of our regions. Okay. So remember when the lockdown happened last weekend or the weekend before and we couldn't go anywhere for the long weekend? The only areas you could go was WACS if you weren't in the Peel and metropolitan area. So everywhere outside of the Perth metro area and Peel belongs to WACS. They owned all the hospitals in those areas. Okay. So within WACS over the last few years, there's been millions of dollars spent on refurbishment, rebuilding and redeveloping sites. The Albany Health Campus, the brand new, or a couple of years old now, Karratha Health Campus, Collie, Harvey, Kalgoorlie, Sutherland Inland Health, and we are going to have new ICUs, HDUs and EDs up in the Midwest within the next couple of years. So most of our hospitals are newer than the metropolitan hospitals at the moment. Okay, what we offer in the rural area. So 40% of ED presentations come to WACS sites. We offer all of the services listed, so everything from birth, surgery, palliative and aged care, chemotherapy, cancer care, residential aged care in some of our sites. Mental health, the new mental health unit is opening up in Geraldton in the next year or so. We have population health, a lot of Aboriginal health obviously in the regions. There are Aboriginal medical health services which are in the country, but they're not under WACS, they're run separately. And we have community health, child health, school health and remote area clinics. For the midwives in the room, we have 18 maternity sites across our regions. We have in-house hospital services, we have midwifery group practice, midwifery-led models. For those of you who are midwives or going to be qualified as midwives soon, we have the home births, we have water births, there are clinics. I'm not a midwife, so I'm just reading the list of what actually happens in the midwifery arena. There is visiting midwifery specialists, we have level 2 neonatal nurseries, and there are shared practice between GP and DMO care, and we have antenatal telehealth classes. Okay, we have a number of different ways of running our grad programs. In the Kimberley, we have the Kimberley rotation program, which some of the successful applicants will stay at Broome and some will rotate through the different hospitals within the region. We have a Pilbara rotation program and a Pilbara transition to ED program. This is its second year, and it has proved to be one of our most popular graduate programs. Some of the grad programs, you go to small remote sites and you can work in anything from a general care area to specialty area. We have HDUs at Geraldton, Headland, Albany, Bunbury, so there's specialised services in those areas. Every grad program, RN, EN or midwife, is supported with a full induction, study days, and depending on which region, you may have between 4 and 6 additional study days apart from the normal induction days across the region. You can get some that are nominated, that is an area that you're particularly interested in, or the standard required study days, which are each sort of facilitated by both in-house and external services to WACS. Okay, the midwifery, all the regional resource centres have midwifery graduate programs. The Wheat Belt have just introduced 2 midwifery group practices in Northam and Narrogin. You don't have to be dual qualified. We have a number of direct entry midwives that apply each year. The only caveat on that would be some of the smaller sites where midwifery practice is offered and you're a direct entry, they may not offer a grad program because you have to work across both services. As a direct entry midwife, you can work across general services, but you have to work under the supervision of a registered nurse. So it's not out of the question to work in a smaller site. Again, we recruit twice a year with all graduate programs now, and midwifery programs are the same as the RN programs. Okay, I've talked briefly about the support across WACS. Everybody gets the initial orientation, and you don't have to do a graduate program, as Natalie has said a couple of times, but as a new employee to any WACS service, you get your orientation and supernumerary days, and you get preceptor and support. We also have a new backup program, which is a bit like telehealth, but it's telehealth for the nurses. You can talk to them for feedback. If you're having a query and you can't get anyone on site that can help you, however, your colleagues on site are your first port of call if you're having a concern. So the backup program was specially funded this year, and it's been running for the past couple of months and has proved hugely successful. Sometimes the conversations that these support people have, it's just a debrief if you've had an instant concern where you just want to talk to someone away from where you are, and feedback from both the backup team and it's not just graduates that use these people, has been tremendous. They feel they've been able to discuss and resolve issues that they felt they had, but including whoever's at the site as well. Okay, attractions to the country. You don't have city traffic, which to me is the best thing. A lot of people choose the northwest regions. The lifestyle up there is very, very different than down here. There's so much cultural diversity. Australia is a multicultural nation, and the regions are no different. We have different cultures everywhere. We have the Aboriginal culture, we have other racial groups as well. A lot of the towns are putting a lot of money into their infrastructure now to attract and retain people into the country. So the skills you will develop in a regional centre, you'll be exposed to more things than you would if you're working at a general medical ward at Charlie's or Royal Perth, because you've got the diversity from paediatrics to geriatrics. You may have them all in the one ward and you'll see all sorts of different things. So it's not restricted to, aged care, mental health, or you get a bit of everything. So the variety is endless. The additional benefits you get with WACS obviously is travelling into the regions. If you're up in the Pilbara and the Kimberley, you've got the Karijini and all those wonderful places to go and see. But the extra benefits is you get supported accommodation when you're in those regions. It does vary greatly from lovely houses to old-fashioned nurses' quarters, but for a year, if that's what you want to do to see some of the country and get that experience, you can put up with anything just about. What else? Depending on the region you are, you do get additional allowances for rural and remote allowances, and the accommodation is subsidised. Okay, the Pilbara transition to emergency department, as I said, has been one of our most successful graduate programs across WACS. So the idea is this program, you work in the Pilbara, you spend 4 months in either Karratha or Headland, and then spend 4-month rotations in the smaller hospitals. Again, demand way exceeds positions available, but like everybody in WA Health, we are increasing the number of graduates, programs and positions we have across WA Health. Bella joined the program. She had been unsuccessful in her first preference and was nominated or selected us, and has probably been one of our shining stars in the Pilbara program because she's willing to give everything a go. She moved away from home, uprooted herself, but I think we've got, I won't say a lifer, but I think she's going to stay with WACS for quite some time. The other option, as Natalie said, you don't have to do a grad program. It is not essential. There are multiple level 1 jobs advertised on the jobs board every single day, and you just have to keep applying. And you might have to apply for a dozen before you get one, but you do have to keep applying. Again, make sure you've got your registration. Otherwise, obviously, no ticket, no work. Now, once you've done a graduate year or your first year, whether it be in a graduate program or a general RN position, we have the travel program. This program runs, it's a 12 or 2-year contract, and it gives you 4-month rotations across the regions. You can pick anywhere, nominate anywhere from Esperance to Kununurra, and you can go between multiple regions and multiple sites. It gives a lot of, apart from the variety, it does give you some exposure to emergency departments and more acute areas if that's what you want to do. We get a lot of nurses who have done a little bit of ED and tried it and quite like it and want to go further into the ED. So they go to some of the sites where you might be the second nurse on call for ED. So you work on the wards, and then when ED gets busy, as it does in most of those small sites, you get pulled in to help with the work in the emergency department. So you can start to build your competencies and ability in the ED and make you obviously more employable. A lot of people ask what can they do to increase their opportunity to get into ED, and if you can do your advanced life support and have that under your belt, that would certainly be a big draw card for you. One of our travellers, Gemma, she graduated from ECU, worked in the Metro, then went up to Darwin. She's been with the travel program for nearly 2 years and has taken up a permanent position up in the Pilbara, and I don't think anything is going to get her back down to Perth in the near future. She just thinks it's amazing. Having worked up in the Pilbara myself, I think it's one of the biggest draw cards we have in WA Health, and if you haven't been there, you've got to go. It is an amazing place to go. Okay. Just some general feedback. I remember one of the grads said that there were less people in the town than she had Facebook friends. Just a few pictures of what you can actually see, and some of these pictures were provided by people on the travel program because they give a lot of feedback, and they're just their experiences. I love to listen to what they're going through because it's just amazing that they've taken that step away from what's familiar to them and are reaping the benefits both in their clinical experience and their life experience up in the regions. A couple of the just photos of some of our new sites or refurbished and rebuilt sites. More. Okay. All I can say is give Country Health a go. We have got in excess of 250 places to fill, and that will be growing over the next few years. So any questions about Country Health before I get kicked off for the next one? No? Would you recommend also putting like second or third preference rural? What, second or third? Like, would you recommend putting the second or third preferences rural as well? If you want to go rural, but you have to remember the vast majority of positions are filled in round 1. There are only a few positions that roll out to round 2. If you want country, nominate all the country ones. But you've got, whether it's metro or country, whatever your first preference is, it has to be where you're really, really keen to go. Don't dice with death, as it were, and think you've got a better chance of getting one place than the other. First preferences are filled very quickly, and then what's left is what's left. No. Oh well. It's been great speaking to a lot of you today, and I wish you all the absolute best of luck over the next few months when you're applying for your graduate programs. But remember, graduate programs are not everything. There are other positions out there. Okay. Thank you.